Hello and welcome. I'm Gina of Solafern. Today we have James MacFarlane of Cantabria Labs presenting a case study of an 11-year-old girl with actinic prurigo and how her pediatric doctors have helped to alleviate her reactions to the sun and light with HelioCare capsules.
Going on now to our case study. Okay, this is just one single patient. This was a spontaneous publication that we knew nothing about. As you know, lots of doctors are using firm block on their patients. They get good results. They try new indications, and then with positive outcomes, they share these results within the scientific community. And here we have an interesting case study that was conducted in a patient with actinic prurigo. What is actinic prurigo? It's a rare chronic photodermatosis. Okay, remember we've talked about photodermatosis before. We've talked primarily about polymorphous light eruption, also solar urticaria. We have good results about the use of oral firm block in helping to reduce the onset and symptoms of photodermatosis. This is quite a rare photodermatosis characterized by small, intensely itchy papules which appear on sun-exposed sites. It can be present all year long, but usually worsens in summer months due to increased exposure and more intense sunlight. The onset is in childhood or before 20 years of age. And interestingly, it is most prevalent in American Indians and Latin American mixed races. Okay, so it is quite strong in South and Central America, although it has been reported worldwide. And you'll see this case was in the case of a young Caucasian girl living in the United States with no Native American ancestry. So very prevalent in American Native people, but it can happen to anyone, anywhere around the world. They believe that it is caused by immunologically mediated genetic factors. There's no cure for actinic prurigo. The main goal is prevention by avoiding sun exposure and adhering to strict sun protection strategies to avoid and reduce outbreaks. Okay. In the case of acute symptoms, the doctor could use topical corticosteroids to reduce the inflammation, to reduce the itching, antimalarials, or a very common thalidomide. So here you can see the kind of rashes, the erythema, the papules, the discomfort that these patients face just due to sun exposure. As I said, we have evidence from the past. We have Cachalanza publication in 2011, Tanyus in 2012, demonstrating that oral firm block is helpful in reducing the onset symptoms and intensity of photodermatosis. This study suggests that it can also be effective in reducing the onset, duration, and intensity of symptoms of actinic prurigo. So here you see excellent before and after photos. You can see really how debilitating this disease is. This is caused only by exposure to light. This was an 11-year-old girl, as I said, Caucasian, living in the United States, suffering from actinic prurigo, and she was undergoing treatment with strict sun protection, so topical sun protection and topical corticosteroids. So that was her normal treatment. In spite of this, from time to time, she would forget to apply her topical sunscreen. She would not apply it correctly, and she would have very acute flares. So the doctors, she was under pediatric care. The pediatricians decided to add 240 milligrams of firm block twice daily to her sun protection regimen. So one capsule in the morning, one capsule partway through the day, and it significantly reduced the duration and severity of skin eruption. Okay, this was the change that was made only by taking the oral firm block What they found also was that sunscreen was no longer necessary at school where there were fluorescent lights. This girl had applied topical sunscreen continuously, even when she was indoors at school with fluorescent lights. That was no longer necessary. And the flares due to inconsistent use of sunscreen disappeared more quickly. Okay, so here, very excellent results in a very serious, difficult sun-related skin pathology. So what are the conclusions? Obviously, oral fern block can be used to increase efficacy of current treatments for actinic prurigo, with particular interest for Mexican, Central, and South American markets, where we have the greatest prevalence of this skin disease. But also, the study provides additional evidence regarding the efficacy of oral fern block in reducing onset, duration, intensity of photodermatoses generally. Okay, so actinic prurigo is a photodermatosis. We have evidence in the past of the effect of oral fern block in photodermatosis. This is providing new evidence, very strong evidence. So it's a good chance to remind doctors of the indication of oral fern block in photodermatosis, especially in those markets where summer is approaching. People will be exposed to more sunlight and to a stronger sunlight. So the incidence of the photodermatosis is going to grow. And the other important thing that the study showed, very interesting, was that often strict photoprotection with topical sunscreen is not sufficient. As Alfonso was saying earlier, in and out, that oral photoprotection can help to boost the topical protection. That is certainly what we saw here, that the girl was applying topical sunscreen was not enough. We gave her the oral as well and got very good results. So often, to completely alleviate symptoms of sun-related pathologies, oral photoprotection can represent an important complement. Okay, so this study done in one patient can be a good opportunity to go back to the doctor to remind him or her of the use of fern block more generally in photodermatosis in the sun and in the summer period, and the additional benefits that we can get from adding oral to topical sunscreen.
For the full case study, you'll find the link in the description below. And if you require further information on HelioCare or on fern block, please get in touch with us. You'll find our website down below as well. See you next time.